The connection between mindfulness and chronic pain relief. Millions of individuals worldwide suffer from chronic pain, which frequently lowers their quality of life. Sometimes conventional pain management techniques are ineffective or have unfavorable side effects. A possible treatment for chronic pain is mindfulness, a mental discipline based in acceptance and awareness. Through the promotion of a stronger link between the mind and body, mindfulness provides beneficial methods for pain management and improving general health. In this video, we will go through 7 key points that highlight the connection between mindfulness and chronic pain relief. Number 7. Mindfulness definition. A mental exercise called mindfulness focuses on keeping an acute awareness of one's thoughts, feelings, physical sensations, and environment in the present now. Though it originated in ancient contemplative traditions, especially Buddhism, this practice has been modified to fit within modern psychological frameworks in order to address a variety of mental health issues. When it comes to chronic pain, mindfulness enables people to see their suffering without getting emotionally invested in it. Pain can be better understood as a passing experience rather than a chronic disease thanks to this non-judgmental assessment. People who practice mindfulness can learn to distinguish between the emotional responses that frequently accompany pain, such as fear, anxiety, or frustration, and the sensory experience of pain. This perspective change is critical because it enables people to react to pain with curiosity rather than aversion. For instance, practitioners can learn to accept pain as a natural part of their experience rather than seeing it as an enemy, which can greatly lessen the perceived severity and emotional load of the pain. In the end, mindfulness encourages acceptance and composure, allowing people to live with their sorrow in a way that lessens its influence on their day-to-day activities. Number 6. Cognitive restructuring. A treatment approach called cognitive restructuring aims to assist patients in recognizing and altering harmful thought patterns that fuel emotional pain and misery. Many people who experience chronic pain come to believe unhelpful things about it, like "I will never feel better," or "this pain defines who I am." Such ideas might exacerbate one's overall pain experience by fostering sentiments of hopelessness and powerlessness. Through encouraging people to become aware of these habitual thoughts without passing judgment or feeling any connection, mindfulness helps people undergo cognitive restructuring. People can learn to watch their ideas as they come to them and acknowledge them as fleeting mental experiences rather than unchanging realities by engaging in mindfulness techniques. During mindfulness meditation, for example, a person may notice and acknowledge a thought such as "I can't stand this pain" without letting it control their emotional state. This procedure lessens the emotional burden connected to experiences of chronic pain and promotes acceptance. People who regularly engage in this non-judgmental awareness can eventually grow to have a more compassionate connection with their suffering and themselves. This mentality change encourages healthy coping mechanisms that enable people to actively manage their chronic pain in addition to lessening the emotional discomfort connected with it. Number 5. Neural changes. Recent developments in neuroscience have shed important light on the ways in which mindfulness training can profoundly alter brain activity associated with pain perception. Functional magnetic resonance imaging, fMRI, and other neuroimaging techniques have shown that mindfulness meditation modifies brain activity in critical regions involved in processing both the sensory and emotional aspects of pain. For instance, studies show that mindfulness can increase activity in the prefrontal cortex, which is connected to higher-order cognitive processes like attention regulation and decision-making, while decreasing activation in the anterior cingulate cortex and insula, regions linked to the emotional aspects of pain perception. These alterations in the brain show that mindfulness helps people separate the emotional burden of pain from its sensory experience, making pain easier to manage. As a result, many practitioners claim that practicing mindfulness causes them to experience less severe pain and unpleasantness. The ability of mindfulness to modify not only one's subjective perceptions of pain, but also the way the brain interprets these sensations is supported by this neurobiological data. A person's capacity to properly manage chronic pain may be improved by mindfulness through altering brain connectivity and function. Number 4. Stress reduction. High levels of stress and anxiety frequently accompany chronic pain, resulting in a harmful feedback loop in which stress aggravates physical symptoms and chronic pain raises stress levels. Because mindfulness techniques improve emotional regulation and encourage calm, they are especially useful for interrupting this pattern. Methods like body scans, yoga, and deep breathing exercises stimulate the parasympathetic nervous system, which in turn triggers the body's relaxation response. This physiological relaxation helps reduce muscle tension that can contribute to increased sensitivity to pain and lowers cortisol levels, a hormone linked to stress. Additionally, mindfulness increases emotional resilience by teaching people how to thoughtfully react to stressors associated with their condition rather than impulsively reacting to them. When faced with an excruciating flare-up, for instance, a person who is trained in mindfulness can employ grounding exercises or deep breathing techniques to calm oneself instead of giving in to fear or annoyance. People who regularly practice mindfulness typically experience relief from physical symptoms like tightness in their muscles and anxiety, as well as psychological anguish. This is because regular mindfulness practice reduces stress. People are empowered to actively manage their chronic pain and stress levels thanks to this holistic approach. Number 3, evidence of effectiveness. The usefulness of mindfulness-based therapies for treating chronic pain illnesses like fibromyalgia, arthritis, migraines, and lower back pain is being supported by an increasing amount of empirical research. Compared to control groups that do not practice mindfulness, participants in mindfulness meditation report significantly lower pain intensity and unpleasantness, as evidenced by a number of studies. For example, a noteworthy meta-analysis discovered that those who practiced mindfulness reported an average 33% decrease in heat-induced pain perceptions when compared to non-participants. Furthermore, these studies frequently show improvements in mental health in addition to physical symptoms. Participants report reduced levels of anxiety and depression after the intervention. Based on available data, mindfulness training can be a useful addition to an all-encompassing chronic pain management program. Furthermore, a number of studies show that MBIs improve coping mechanisms and improve the quality of life for people with chronic illnesses. Participants often report feeling more empowered and self-sufficient in relation to their health. Number 2, long-term benefits. Long after finishing structured mindfulness programs like mindfulness-based stress reduction, many participants report continued benefits from mindfulness, going much beyond just instant relief from chronic pain. Years after initial therapies, follow-up studies have demonstrated that individuals still possess improved coping techniques, emotional resilience, and general quality of life. This long-lasting benefit is linked to the abilities acquired during mindfulness training, such as acceptance and self-awareness, which enable people to control their symptoms more skillfully over time. A lot of people who practice mindfulness discover that it becomes a lifelong habit that continues to improve their mental and physical well-being. For instance, someone who has finished an MBSR program may continue practicing meditation or mindful movement frequently as part of their self-care routine. This ongoing commitment helps reinforce good changes in behavior and mindset over time. Consequently, a great number of people report better chronic pain management together with improved general well-being, including increased enjoyment of everyday activities and strengthened interpersonal interactions. Number 1, alternative to traditional treatments. When it comes to managing chronic pain, mindfulness presents a strong substitute for conventional pharmaceutical therapies, which frequently entail the use of opioids or other drugs with unfavorable side effects and dependency concerns. According to research, MBIs can manage the symptoms of chronic pain just as well-established psychological therapies like cognitive behavioral therapy without the possible negative effects of using medication. Healthcare professionals can give patients a comprehensive strategy that minimizes reliance on medication by including mindfulness into treatment programs and emphasizing self-awareness, emotional regulation, and personal empowerment. This integrated approach takes into account the psychological as well as the physical components of chronic pain, improving total well-being through lifestyle modifications that strengthen coping mechanisms and build resilience. Additionally, by reducing reliance on drugs and medical procedures and enhancing patients' general quality of life, integrating mindfulness into treatment programs can lower healthcare expenditures. In conclusion, incorporating mindfulness into the treatment of chronic pain offers a comprehensive strategy that addresses both mental and physical reactions, giving patients who experience ongoing agony hope for a better quality of life. If you liked our video, please hit the like button and subscribe to our YouTube channel.